For decades, doctors believed something that feels unthinkable today. They believed babies couldn't feel pain. Not that they felt less pain, but that their nervous systems were too underdeveloped to experience it at all. So during surgery, doctors often didn't use anesthesia, not during circumcisions, not during open operations, not even during heart surgery. Babies were sometimes physically restrained while doctors operated, and the crying? That was dismissed as reflex. This belief dominated medicine well into the 20th century. Textbooks taught it, hospitals practiced it, and no one questioned it until the consequences became impossible to ignore. Doctors began noticing something disturbing. Babies who underwent surgery without pain reflex had extreme stress responses. Heart rates spiked, blood pressure surged, stress hormones flooded their systems. Some infants went into shock, others died. Even worse, survivors often showed long-term effects, heightened pain sensitivity, abnormal stress responses, developmental and behavioral changes later in life. Pain wasn't just something babies experienced, it was something their bodies remembered. The turning point came in the 1980s. Studies began measuring stress hormones like cortisol in infants during surgery. The levels were off the charts, far higher than in adults. The idea that babies couldn't feel pain collapsed fast. By the late 1980s and early 1990s, medical guidelines changed. Anesthesia and pain management became standard for neonatal procedures, not because medicine suddenly became compassionate, but because ignoring infant pain was proven to be dangerous. What doctors once believed was harmless was actually causing long-term damage and sometimes fatal outcomes. Today, infant pain management is a core part of medicine, but the story remains a warning. Not all medical practices are cruel on purpose. Some are based on beliefs that simply haven't been challenged yet. And when it comes to medicine, being wrong can take decades to undo, especially when the patients can't speak for themselves.